patients.
No, I like the way that's the key word, isn't it? It's making things better.
Yeah.
Making things better for everybody.
Yeah, for everybody.
Because it's when the clinicians feel more accomplished and more satisfied and more fulfilled with their work, that passes on to the patient.
Yeah.
And I feel that's the right way we should think about that.
And I'm sorry for interrupting, but the one thing I think that you said earlier on was all about the team. Because if you do work in that way, it also spills over to the team. You get the team that is really working with the patient, and enthusiastic team that is doing the best they can for the patient. And I think the aftercare that you mentioned is another thing that is really important for the patient over time, to feel that someone is taking care of me. If I have a question, I can ask.
That's it, yes. We feel that. We certainly encourage that, and we let it flourish at New Life Teeth, the work culture that we have here with our team. And the team feel it when a patient is going through an incredible journey. They love to be a part of that. It's so rewarding for everybody. And you're right in saying it's about the team and the fulfillment for the team as well. One thing that we're at a stage in our business, we always like to stay ahead of the curve. And when we make things faster and better for our patients, whilst it has a financial impact on our business, we have to be at that forefront. And if we want to be involved in such a wonderful accolade as the Association Brånemark, we feel it's our duty to be that clinic, that team. One of the things that I'm really interested in at the minute, going back to the design stuff and how things are changing with how we can make efficiencies and more accuracy, and helping our younger clinicians coming through this part of the journey to be at a stage where we can expedite their journey. And I think that's something that I didn't have that privilege, and we always feel hard done by, don't we? I'm at the generation when you see the younger ones coming through, you feel, I wish I had that opportunity. But it's important that we expedite their journey to success, because the sooner they're at success, the more they can spread that success to the people. And one of the things we're doing at the minute, we have intern programs within our business, and we're very proud of this. We feel it's so important for the future of dentistry that our interns, we handpick these wonderful young clinicians. And it's not just about their dexterity, it's not just about what they can do with their hands, because we feel if we get the right person, we can teach them that. We have the experience and the credentials and the back catalogue, we say, where we can show them where the complications are. But we pick these clinicians that are very empathetic, that are they're in sync with their patients. They're great communicators. They have charisma, and they're great communicators, and that's so important. Whenever they can put the person at ease, whenever they can speak with knowledge and reassure that person. And once we have that type of clinician, they go seamlessly through our intern program. We buddy them up. They're buddied up with an experienced clinician. I call this the golden ticket, because I feel it is the golden ticket for a young clinician to come through at late 20s after they've done all their undergraduate training. They come out, and at that stage in your career, you're maybe not so sure where you want to be. You're not so sure what type of dentistry you want to do, and there's a lot of talent out there. And we want to nurture that and nourish it in the right environment. There's no getting away from the fact that you have to do volume. It's like anything else, you have to do the hours. There's the old saying, the 10,000 hour rule. If you do that, you're going to be good at what you do. Yeah. But what we don't want is our clinicians coming into our business that are making mistakes, and we ensure that never happens, because they're partnered up with a very experienced clinician. They have a personal trainer, they have a coach to look after them as well. Somebody who has been through this journey, somebody who has come out the other side and has perfected their technique. We're always learning, but somebody who has perfected their technique to pass on this knowledge. And we also ensure that they then come through our clinics and they're enrolled on a postgraduate qualification. That's very important for us, and I think it's very important for the personal development of that intern that they are they have an accreditation at the end of it. Sure. They have something to show for the efforts that they're putting in. But there's nothing getting away from the fact that they are immersed in an environment where they are seeing these cases on a daily basis, and they're learning from experienced clinicians. And then you, at a very quick level, you expedite that knowledge transfer. And if you have the right individual, which we make sure we do in our business, and New Life Teeth, there's a strict criteria of the clinicians that come through here, we can expedite that knowledge transfer. But one of the things that really interests me going forward for us to be ahead of the curve are the ways that we can perform surgery. And my generation, I was taught I think the term is the brain-guided way. You know, you guide your hand with the anatomy. We make sure that the clinicians, that you knew your anatomy, you know every structure in the face, so you know you can identify and you know when you're making, you know when you're in the right position. But that brain-guided way, it's a difficult journey to teach that. It's a difficult way for somebody to learn that. You know, it's years and years of development. And I feel there's maybe better ways out there with advancements in technologies. There are better ways out there. So what we're looking at and what we've been doing in the business, again, to stay ahead of the curve, we're adapting a pilot guide technique. We're adapting a full stackable guide technique, and we're exploring the option of some dynamic guides. We get some assistance with some computer softwares, but the one that's really fascinating me at the minute is the haptic robotic guided way of performing surgery. I feel like this is something that's going to revolutionize the industry, because it gives the clinician that control, but it gives them the sensory feedback of where they're at and what they're doing. When you're in that pressure situation of a surgery, you want to be so accurate with what you do, because you get one chance to do this correctly for a patient, I feel. And you know, you don't want to overlook that responsibility, and the fact that you can have that interactive feedback with how you're performing that surgery, I definitely do feel that's the future. But of course, there's a learning curve with all these new things that come out, and you don't want to be the first mouse doesn't get the cheese. So we want to be the ones that are communicating with our colleagues in the association, and there's such an amount of pioneers in this group that we're involved with, that I know that we're going to get the answers quicker when we communicate this.
No, I agree with that, and I think that's a bit what we talked about earlier in regards to different materials and so on. But you also have how you get to the result with new technology, I think the whole part sometimes is to when is the time right, as you were saying. You don't want to be the first mouse.
Yes.
It's about the timing.
Yes,
and when is the time right. But for sure, it's going to be more and more help tools. But I think it's important that what you do with the interns is that whatever tool you are using, you need to have the knowledge how to use the tool. And sometimes you need to have some common sense when you use the tools as well, right?
Yes.
So it's like, it's also a balance. But if I go back to what you said earlier about the intern program you have, is that if you are a dental student today and they go through undergrad, when I went to dental school, there were not that many procedures. So we learned a lot about very few procedures. Today, there are so many different procedures. So when you come out of dental school today, you know a lot of procedures, but you haven't learned perhaps as much depth as at least when I went to dental school. So it's really important, like you're saying, that when they are joining a clinic, that especially a clinic that is like yours, where you are focused on certain treatments, that you really, really take everyone through the certain education program. But I think what is even, if I go back to patients again, what is even more important, that in that internship, you not only provide them with the training about the procedures, the thing that you're also providing is your culture.
Yes.
The culture of the clinic.
Yes.
You know, how you view you as a person, how you view your patients, all the other things that are really, really important. And then you have a process for how to interact and adding new technology to the practice. And if that becomes that you are sitting on a beach doing implant surgery with a robot in your practice, who knows, you know?
Who knows?
What the future will tell. You sit with gloves on the beach and doing implant surgery. You know, that might be. Who knows?
Well, it's been involved. This technology's been around in medicine for a few years now, and I think maybe the dental side is just coming on the back of a wave to get involved in it. But you're right. Yes, it's a steep learning curve, and it's not about things spread by osmosis within a team, but it's also about reinforcement with your team that what's important, and all about reducing the complication. It's all about reducing that complication for that patient, and you know this is what we're in the business for.
Make it right the first time.
Make it right the first time. Yeah. And it's a legacy. I also say that you know when the younger clinicians are coming through, you know you're going to be responsible for patients for a long time, and you have to get it right first time. But you have to, if there is any corrections that have to be done, you have to be able to do that, and again in a controlled way. I like it when we have a plan B sometimes, and you know I think that's important with the cases that we do. Whilst we always insist that we get it right first time, it's nice if we have a plan B and be responsible, because you have unfortunately younger patients coming through again through no fault of their own. And that you have to provide this wonderful treatment for them, because you can't expect them to walk around with poor function, with poor aesthetics. They don't want to live their lives like that. But we're providing this treatment for a younger demographic. We have to be responsible for the future, and that plan B for us is always a lovely way to do things. And I think again that's important that we know that. So we keep it simple. Get it right first time, but keep it quite simple. So the more complex stuff we can maybe tackle later on, and hopefully we never need to.